What aftercare do you need to be aware of if you're having laparoscopic surgery for endometriosis? Number 1, how to care for your incision sites. Typically speaking, you're given waterproof plasters that cover each incision site. Waterproof meaning you can shower with them on. If the plasters start to come off, remove, gently clean and tap the surrounding area dry and then replace. Approximately 5 days later, if you're healing well, you can remove the plasters for good. That means you can shower without any coverage. Do not scrub them in the shower. Don't touch them. It's enough for your shower gel foam to wash over them and gently pat dry or air dry before wearing clothes. This is to avoid infections from forming because dampness can mean bacteria overgrowth. If there's redness or pussing, contact your GP or surgeon for advice, as this may indicate infection. Tip number 2, food and nutrition after surgery. Now, unless you've had surgery on your bowel like I did, where I had a resection, it's unlikely that you're going to receive any nutritional advice. But after any surgery, general rule of thumb would be to reduce or eliminate your intake of acidic or inflammatory foods to aid the healing process by reducing the prospect of causing additional inflammation in a body that's already inflamed, therefore supporting the healing process. If you've had a bowel resection, like I did, a strict low fiber and low fat diet is required. You need to adhere to it for 2 to 3 weeks. I talk all about the diet that I followed in this post. Back to anti-inflammatory and gut-friendly foods, you're going to want to focus on foods that are gentle on the stomach and that won't compromise gut health. After all, approximately 70% of our immune system lives in the gut. Foods like bone broth that are soothing and contain gut-friendly bacteria. Probably best to avoid foods that bloat, whether that's wheat-based foods, beans, legumes, tomato-rich foods, or certain spices. Now, we all tolerate inflammatory and acidic foods differently. I'm not going to tell you what you should or shouldn't be eating. It's just a general overview. Aim for foods that aren't inflammatory for you. Foods that don't cause you any symptoms. Painful bloating, excessive gas, acid reflux. That could be lean meat or poultry, fresh fish, tofu, cooked veggies, berries, boiled rice or potatoes, and so on. Keep it simple and aim for home-cooked foods as much as possible, especially in the early stages of recovery. Tip number 3, physical limitations after pelvic surgery for endometriosis. Now, you're encouraged to walk from the get-go, as it helps to relieve the shoulder gas pain. At the same time, by keeping yourself mobile, you're helping the healing process, aiding blood circulation and lymph flow. So do try to walk throughout the day at a pace and duration that works for you. Don't overdo it. I started by walking up and down the aisles at the hospital for 5 minutes, then 10 minutes, working my way up to 20. Back at home, where I was recovering at my mum's, I walked around the back garden until I felt steady on my feet to hit the outdoors. So walking and light movement is good for you, but no heavy lifting. Avoid bending over at the waist. If you need to pick anything up off the floor, squat down. No gym, no weights, no strenuous activity until the 6-week post-op mark. Now, everyone has different fitness and physical capabilities. Some women might feel well enough to train 3 to 4 weeks post-op. I mean, you know your body best. But the general advice is to avoid exercise until the 6-week mark. Avoid any deep core work until the 12-week mark. Tip number 4, know the warning signs of possible post-op complications. I was told to look out for high temperature, continuous headaches, dizziness, nausea, vomiting, and incision site redness or pussing. These symptoms are the general signs of infection, where you should consider contacting A&E to get yourself checked out. Now, because of my bowel resection, I was also told to monitor my bowel movements. Continuous constipation, or the opposite, constantly needing to go, should be reported to the surgeon or your GP, as well as things like rectal bleeding. I was told that bleeding out of the vagina is pretty normal. I didn't have surgery on my vagina, and the reason for bleeding wasn't really explained other than I'd had pelvic surgery. Again, this was something that I monitored, and I was told unless it worsened or increased over time, then it should naturally ease off all by itself, which fortunately is what happened in my case. But do note that any excessive bleeding should be reported ASAP. Finally, tip number 5, pelvic physiotherapy. Now, most women with endometriosis will experience pelvic floor dysfunction or a tight pelvic floor. I for sure had a tight pelvic floor, which also meant that it was weak. After surgery, where everything is freed up, I actually had my first ever, and I hope never again, experience of bladder incontinence. Because of my bowel resection, I had to work to retrain my rectal muscles too. So I was shown pelvic floor exercises, ranging from doing pelvic tilts to your squeezing exercises and holding for 10 seconds. That's starting from the back to the front up to your belly button, followed by the pulses. And yet I believe that most women don't get any pelvic floor physiotherapy full stop, let alone after surgery, when it's probably the most essential to ensure that you regain full function, that you have a functional pelvic floor. So if you're interested actually in a bit of a demo of the pelvic floor exercises that I received, I'm happy to make a video where I demonstrate them for you. And an additional tip would be to ask if your GP doesn't mind redoing some of the tests that you would have had done at hospital. That would include things like a full blood count, your white cells, your red blood cells, liver function, kidney function, electrolytes, and CRP, which is an inflammation marker. In saying that, expect your inflammation markers and your white blood cells to be high. This is normal after surgery, but what you're looking for is for them to steadily come down in the weeks post-op. You want them to normalize. And that's a wrap. What I have shared is very generalized. Surgical treatment for endo can take many twists or turns. For me, it was a bowel resection. For others, they could have had a bladder resection, hysterectomy. If you have any aftercare tips that you would like to add for women due to undergo surgery, please share your advice in the comments.